Chapter 9, Chapter Objectives. Upon completion of Chapter 9, the learner should be able to do the following. Describe reasons for acquiring capillary blood specimens. Identify the proper sites for performing a skin puncture procedure. Explain reasons for controlling the depth of the incision. Describe the procedure for making a blood smear. Indications for skin puncture. Skin punctures are particularly useful for both adult and pediatric patients when small amounts of blood can be used for laboratory testing. For pediatric patients, it is crucial to withdraw only the smallest amounts of blood needed for laboratory testing to reduce the effects of blood volume reduction. Thus, for neonates and infants, use of capillary blood samples is the preferred method of collection. In contrast, a 10 milliliter blood sample taken using a venipuncture method, which could be tolerated by most adults, would represent 5 to 10% of the total blood volume in a neonate's body. If small amounts of blood are acceptable for laboratory tests, skin punctures or finger stick procedures are used when the following conditions occur in adult patients: fragile veins or difficult to access veins, when veins are being saved for therapy, such as for cancer patients. Patient had already had unsuccessful venipunctures and tests require small amounts of blood. Home testing, such as blood glucose monitoring. Point of care testing, POCT. Severe burns or scarring on the common venipuncture sites. Obese patients. Thrombotic tendencies. Patient is receiving IV therapy in both arms. Patient is fearful or anxious about venipunctures. Patient may need only one blood test that could be done on a small sample volume. Finger stick procedures are not recommended if the following circumstances are present. Laboratory testing requires large amounts of blood, such as blood cultures, erythrocyte sedimentation rates. The patient has swollen fingers. If a finger stick is performed, the interstitial fluid may dilute the blood sample. The patient is dehydrated, lacking or loss of water from the body. A patient may have poor peripheral circulation near the outer surfaces of the body. Coagulation studies because of the dilution effect with interstitial fluid. Box 9.1 shows laboratory tests commonly performed using capillary blood samples. Blood smears for white blood cell differential, manual blood smears on microscope slides, complete blood count, hemoglobin and hematocrit, electrolytes, neonatal blood gases, neonatal bilirubin, neonatal screening using filter paper or blood spot testing, point of care testing, and or home testing. Clinical alert. Venipuncture in children, especially infants, should be avoided when possible because of the risk of complications due to taking too much blood, which is called iatrogenic hazards, or difficulties with the puncture sites. These complications may include anemia, cardiac arrest, hemorrhage, venous thrombosis, damage to surrounding tissue or organs, infections, and injuries from restraining the child during the procedure. Composition of capillary blood. Capillary blood acquired by skin puncture is different from that of venous or arterial blood samples acquired by other methods. Capillary blood is more of a mixture, composed of blood from arterioles, venules, capillaries, and intracellular and interstitial tissue fluids that form within tissue layers and gaps. Generally speaking, capillary blood has slightly more arterial blood than venous blood because the arterial pressure in the capillaries is stronger than the venous pressure. Thus, there are slight differences in laboratory values of glucose, potassium, total protein, and calcium when serum or plasma has been compared with capillary blood, in all cases except glucose. The values are lower in skin puncture blood. Collecting diagnostic capillary blood specimens. The first step used for venipuncture procedure also applies to skin puncture procedure. Preparing oneself and supplies, identifying the patient, asking about latex allergies and fainting, performing hand hygiene, and cleansing the puncture site. However, subsequent steps are slightly different. Supplies for skin puncture. Supplies for skin puncture are available from many manufacturers. See Chapter 6, and depending on the actual tests that are ordered, the supplies may differ, but the basic list includes the following: disposable gloves, commercially available warming pack, heating pad, towels, etc. for warming the site, sterile disposable single-use puncture device with a permanently retractable blade or needle. There are many types of puncture devices available based on style, size, and depth. Use the appropriate device for each patient situation based on the manufacturer's instructions and the procedure at each facility. Disinfectant pads, 70% isopropanol, sterile non-latex bandages and gauze pads, glass microscopic slides if needed for manual WBC differentials. Diluting fluids are as required by manufacturers. Plastic micro collection tubes, plastic coated capillary tube seals or closures, laboratory request slips or labels, a marking pen, a puncture-proof biohazard discard container. Clinical alert. Glass capillary tubes should not be used because they break easily and can cause injury. Use plastic capillary tubes instead. Refer to Chapter 6 for more information. Skin puncture sites. Skin puncture in adults and older children most often involves one of the fingers. The fleshy central palmar surface of the distal phalanx fingertip section of the third middle finger or fourth ring finger of the non-dominant hand is the preferred site for puncture. The non-dominant hand is often less callous, so the puncture is more effective. The puncture should be made at the thickest part of the finger, just off-center, not the sides or extreme tip where the tissue is not as thick. The site should be warm and free of calluses, burns, cuts, scars, bruises, or rashes. The finger should not be cyanotic, which is bluish in color due to lack of oxygen, edematous, or infected. For infants less than 1 year old or neonates, the recommended site for skin puncture is the lateral or medial plantar surface of the heel. The heel stick procedure is covered in detail in Chapter 10. Clinical alert. The following sites are not generally recommended for routine skin punctures. The earlobe. Even though the earlobe is still used by some, it is not a preferred site because of the possible interference with pierced earrings, also because of the site's close proximity to the eyes. A puncture device may cause undue anxiety to a patient, resulting in a jerking of the head. Central arch area of an infant's heel and the posterior curve of the heel because of the risk of injuring nerves, tendons, cartilage, and bone. Fingers of a newborn or an infant less than 1 year old because of the risk of hitting the bone and causing infections. The fifth pinky finger because the tissue of this finger is considerably thinner than that of the others and there is a risk of hitting the bone. The thumb because it has a pulse. The index or pointer finger because it may be more sensitive and or is more likely to be callous. Swollen, infected, callous, burned, cut, scarred, bruised, have a rash or previously punctured sites because accumulated fluid may contaminate the specimen and the site may be bruised, thus causing more pain if it is punctured again. Fingers on the side of a mastectomy because the removal of lymph nodes during surgery may result in excessive lymph fluid on the side of surgery. Consult with the ordering physician in the case of bilateral mastectomy. Warming the skin puncture site or lowering the arm. Although clinical practices are variable in healthcare facilities, warming the skin puncture site helps facilitate phlebotomy by significantly increasing arterial blood flow to the area, thus arterializing the site. Several easy-to-use methods of warming are commercially available, or the site can be warmed with a heated surgical towel or a washcloth heated with warm water to 42 degrees Celsius, which will not burn the skin. Some facilities ask the patient to wash their hands in warm water to take advantage of the warming effects. In addition, sometimes it helps to simply lower the patient's arm for a few minutes by pointing the fingers downwards towards the floor. This allows gravity to fill the capillary beds of the fingertips. Cleansing the skin puncture site. The skin puncture site should be cleaned with 70% aqueous solution of isopropyl alcohol and allowed to thoroughly dry before being punctured. If alcohol drips or pools at the site, it can cause hemolysis and contaminating tested for glucose determinations. Also, alcohol present during the puncture will sting the patient and prevent the formation of well-rounded drops of blood, which are best for making blood smears on microscopic slides. Skin puncture procedure. Because skin punctures require different procedures when performed on infants, refer to Chapter 10 for information about skin puncture collections on newborn babies, blood spot testing for newborn screenings, heel puncture procedures, and specimens for pediatric blood gases. However, there are some precautions that are applicable to both adult and infant skin punctures. Skin puncture devices should be sterile, disposable for a single use, and have a permanently retractable safety blade or needle. Some lancets have a needle-type puncture device and others are designed with an incision device. Healthcare workers should understand and follow the manufacturer's direction for the use of each device. Puncture devices are made to control the variable depth and length, depending on the patient's age and weight. The average depth of skin puncture should be 2 to 2.5 millimeters for adults and less than 2 millimeters for small children and infants to avoid injuring the bone. Laser devices are also available as skin puncture alternatives. They provide a smaller hole Procedure 9.1, basic skin puncture for capillary blood collection. Rationale: to obtain blood samples in smaller amounts and in a less invasive manner than venipuncture procedures. Remember to follow the procedure adopted by your healthcare facility and the manufacturer's instructions. Equipment: disposable gloves, sterile disposable single-use puncture devices with a permanently retractable blade or needle, disinfectant pads, sterile bandages, prepackaged gauze pads, 2x2s or 3x3s. Glass microscope slides as needed, diluting fluids for specific tests, plastic micro collection tubes or plastic coated capillary tubes, capillary tube sealers or closures, laboratory request slips or labels, a marking pen, a puncture-proof biohazard discard container. Preparation: be emotionally prepared and greet the patient to put him or her at ease. Ensure proper patient identification and review the test requisitions. Prepare supplies and choose the correct puncture devices. Remember to use the correct puncture device for each patient. If the wrong size is used, it may result in prolonged collection, excessive squeezing, poor sample quality, hemolyzed or clotted, possible redraws, and/or patient injury. Position the patient in a safe chair, comfortable bed, or reclining chair. Verify dietary conditions. Check for latex sensitivities, if latex products are in use, and whether or not the patient has fainted before or during blood collections. Exercise standard precautions and perform hand hygiene and gloving techniques. Procedure: ask about hand preference and check hand dominance. Try to use the non-dominant hand. Choose a finger that is not cold, cyanotic, or swollen. Choose the tip of the third finger, or if needed, the fourth finger of the non-dominant hand if possible. Warm the hand to increase blood flow. Wrap it in a warm towel for 3 to 5 minutes or use a commercially available warming device or heat pad. Cleanse the site with an alcohol pad and allow it to air dry. Do not blow on it. Remove the puncture device or lancet from its packaging and follow the manufacturer's instruction. Let the patient know that they will feel a prick. Hold the patient's finger or heel in the case of an infant firmly with one hand with your thumb away from the puncture site next to the patient's fingernail. With the other hand, position the puncture device on the site, holding it perpendicular to the finger surface. Activate the release mechanism. When possible, orient the cut across the fingerprints, perpendicular to the fingerprint grooves, or generate a large round drop of blood. If the puncture is made along the lines or parallel to the fingerprint, a well-rounded drop will not form and the blood tends to run down the finger. Discard the puncture device in a puncture-proof biohazard container. If a biohazard container is not within reach, discard the device immediately after completing the collections. Wipe the first drop of blood away with a clean gauze, unless otherwise indicated. Some point-of-care instruments do not require this step. Always follow the manufacturer's instructions. Collect the second drop of blood by touching it to the tip of the collection device. The blood will flow into the tube by capillary action, whereby blood flows freely into the tube on contact without suction. If the blood becomes jammed in the collection top, a gentle tap on the hard surface will usually dislodge it so the blood can flow freely again to the bottom of the tube. Collect the blood quickly to minimize the effects of coagulation process, microclots or platelet clumping, and to avoid prolonged exposure to air for blood gases and light for bilirubin. Gently apply pressure to the finger and hold the puncture site in a downward position to encourage the free flow of blood, thereby getting the proper amount of blood. Do not use excessive milking massaging of the finger or forceful scraping or scooping up of blood because it may result in excess tissue fluid and or hemolysis of the specimen. Basic skin puncture for capillary blood collection continued. Follow the correct order of draw. Each type of microcollection laboratory test has a different tube and blood volume requirement. Follow the appropriate manufacturer's instruction. Fill tubes to the correct fill volume to avoid the effects of inaccurate blood to additive ratio. Mix specimens according to the manufacturer's instructions, usually by gently inverting containers and additives to mix the blood with the additives. Carefully and safely seal microcollection tubes with a sealant or with other commercially available devices as needed. When filling capillary tubes, do not allow air bubbles to enter the tube, as air bubbles can cause erroneous results in many laboratory tests. Blood flow is better and air bubbles are less likely if the puncture site is held downward and gentle pressure applied. Blood smears can also be made from subsequent drops of blood. Using a clean gauze pad, apply gentle pressure to the site until bleeding is stopped. The hand may be slightly elevated. Label each tube correctly and in front of the patient to verify identity and prepare the specimen for transport. Discard all other biohazard supplies, puncture devices and puncture-resistant containers and gauze, etc. into approved biohazard containers before removing gloves. Remove and dispose of gloves in a biohazard container and perform hand hygiene. Ensure that the bleeding has stopped. Ask the patient to verify that the labels have his or her name and thank the patient before allowing him or her to leave, or if in a hospital setting, before leaving the specimens and remaining supplies. In healthcare facilities, the puncture devices used are typically small, single-use, disposable devices. However, in home settings, a patient may have a multi-use device in which only the lancet is changed after each use with a single patient. In this case, discard the lancet and clean the multi-use device according to the manufacturer's instruction if it becomes contaminated. A free flow of blood is essential to obtain accurate test results. Do not use excessive squeezing, massaging, or scraping to obtain blood. If the blood drop used for a specimen is allowed to remain on the skin too long, some evaporation may occur and the drop may dry out. If this happens, wipe away the drop and use the next one. Otherwise, it may result in erroneous laboratory values. If the sample is not adequate and the blood has stopped flowing from the puncture site, use a new sterile device to repuncture it at a different site. Be sure to warm the site prior to repuncturing to improve the blood flow to the area and re-cleanse the puncture site. Avoid excessive punctures on one finger and or hand. Clinical alert. If the bone is repeatedly punctured, it can lead to osteomyelitis, which is an inflammation of the bone caused by bacterial infection, or osteochondritis, inflammation of the bone and cartilage. Manually used blades or lances without retractable features and or depth control are never recommended for acquiring capillary specimens because they can cause more bruising and inflammation than automated retractable devices. They are more likely to cause accidental injuries with the exposed sharp, and they tend to be more painful. Order of collection. The order of filling microcollection tubes with capillary blood is different than for venipuncture. If multiple laboratory tests have been ordered, the order of collection should be as follows: blood gases, EDTA, a specimen for hematology tests, other tubes with additives, and serum tubes. Also refer to Figure 910, which shows one manufacturer's instructions for the order of the draw, and mixing procedures. Clinical alert. There are several pre-examination variables that require special attention when collecting skin puncture specimens. Microcollection tubes must be adequately filled, and if they contain additives, they should be gently mixed. If it takes too long to fill the tube, microclots may form. Remember that as soon as the skin is punctured, the coagulation process begins, so collect the specimen quickly to minimize the effects of platelet clumping, exposure to air, and light. Excessive amounts of overfilling can cause clot formation. Inadequate amounts or underfilling can cause cells to change morphologically because of too much anticoagulant. Hemolysis of the capillary blood specimen is a complication that can cause erroneous laboratory results and is usually preventable if good technique is maintained. Hemolysis is caused by not removing residual alcohol or not allowing it to adequately air dry at the puncture site, excessive milking or massaging of the finger. Patients have an increased blood cell fragility and high packed cell volume, such as newborns and infants, excessive shaking while mixing the specimen. Blood films for microscopic slides. Blood smears are not used in all laboratories because current technologies do not require them. However, other laboratories still use this method for confirmatory purposes or as a backup procedure. Procedure 9.2 demonstrates one method for making blood smears on glass slides used for microscopic analysis for performing white blood cell differentials, which is a hematological laboratory test to approximate percentages and determine morphology of the white blood cells. Red blood cell and platelet morphology can also be assessed. Healthcare facilities can vary the procedures that they use to make blood smears, so appropriate procedures must be followed at each facility. It takes a significant amount of practice to learn to make slides that are acceptable for use. Healthcare workers must be adequately trained to make consistently good slides for microscopic analysis. Procedure 9.2, blood films for microscopic slides. Blood films on microscopic slides can be used to evaluate the morphology or the form and structure of the blood cells. The microscopic slides are prepared with a blood drop following this procedure. They are stained with special stains in the laboratory and evaluated under a microscope. Although some facilities no longer use this manual method, it is still used in many cases for detecting cellular abnormalities for confirmation and/or as a backup method. Equipment: gloves, glass slides used for microscopic analysis, drying rack or other clean surface, same supplies used for procedure 9.1. Procedure: make blood smears from fresh drops of blood. Make blood smears from fresh drops of blood. Perform the finger puncture in the usual way, wiping the first drop of blood away. Touch the slide to the second drop at approximately 0.5 to 1 inches from the end of the slide. Blood smears may also be made using anticoagulated EDTA blood from a lavender top tube. However, it should be done where there is minimal exposure to blood or blood spills. Place the second spreader slide in front of the drop of blood and then pull it slowly into the drop, allowing blood to spread along the width of the slide. Again, remember that procedures for making blood smears can vary, so follow the methods used at your site. When the blood spreads almost to the edges, quickly and evenly push the spreader slide forward at an angle of approximately 30 degrees. Do not press downward. The only downward pressure should be the weight of the spreader slide. Allow the slide to air dry. Do not blow on it. Blood film should have a feathered edge as shown in the first slide. It has a visible curved edge that thins out smoothly and resembles the tips of a bird's feather, and it covers approximately half the surface of the glass slide. In Figure 9.15, the last 4 slides are not acceptable for analysis. No ridges, lines, or holes should be visible in the smear. Errors are often a result of too large a drop, too long a delay in making the smear, blowing on the slide, or using a chip slide. Label the slides and prepare them for safe, secure transportation to the laboratory. After the procedure, discard any unusable or contaminated slides and all biohazardous waste in an appropriate container. Cleanse your hands. Label the slides according to the correct ID procedure at your facility, which usually includes a complete label for each slide. Thank the patient for cooperating. Reconfirm identity. and allow the patient to leave in an ambulatory setting or depart with all specimens and all remaining supplies. Transport and/or deliver the slides to the laboratory. Supply disposal, labeling the specimen, and completing the interaction. Used disposable puncher devices or lancets should always be placed into a rigid, puncture-resistant biohazard container with a lid. Contaminated supplies such as gauze, gloves, etc. should be disposed of in other designated biohazard containers. Carefully follow the disposal procedures of each healthcare facility. All tubes must be appropriately labeled immediately after collecting and mixing, and the information on the labels must be confirmed. Several tubes may be placed together in a larger labeled biohazard transport container. All supplies and equipment that were brought in should be removed or discarded appropriately. Hand hygiene must be performed again after contact with each patient. Before leaving the patient's side, check the puncture site to make sure that the bleeding has stopped. Then thank the patient for their cooperation. An adhesive bandage can be applied. However, bandages are not recommended for infants or young children because of possible irritation and the potential of swallowing or aspirating the bandage. This concludes Chapter 9.